Joining us for this Plus Talk is Dr. Anusa Chaudhry. Good to see you, Doc.
Good to see you too, Carl. Long time no see.
Happy to see you. We sat here 2 years ago and talked about monkeypox quite a bit. It's been all over the news. The World Health Organization has called it a global health emergency. What does that mean for us here in the States?
Nothing yet. So the reason for calling it a global health emergency is to make sure that we're aware of it and take the necessary precautions to decrease the risk of spread, right? So with other nations, right now it's contained to Central Africa. I think it's just in case that we hear of cases spreading, then we're on top of the game. We can start vaccinating individuals and limit the spread.
How is this one different from 2022?
Good question. So monkeypox, let's just talk about monkeypox from the beginning, right? So it's a zoonotic illness, means that it spread from animals to humans, and this dates back to the 1950s where it was first found in monkeys, and then in 1970 was when they found the first human case. Now with monkeypox, we've heard about COVID and the multiple different strains, right? Delta, Omicron, etc. Monkeypox, as of right now, there's two different strains, and this is what you're going to hear is clade 1 and clade 2.
Okay.
Back in 2022, the virus that was spreading was clade 2, and various strains of it, clade 2A and 2B.
Oh, you're getting in the
I know.
Right, okay.
Right now, it's a strain from clade 1 that's spreading. What's the main difference is that, unfortunately, the strain that's spreading right now is a little bit more aggressive and virulent. So it's causing patients or people to become more sick, and unfortunately, the mortality rate is a little bit increased.
So how's it spread?
Same thing as what we knew from 2022, direct contact, close contact with individuals, either through sex, saliva,
What about towels and bath towels and sheets and things like that?
Not necessarily. This has to be prolonged close contact.
Got it. Who's at risk?
Everybody, I would say.
Anyone, right? Yeah, well, so remind us of some of the symptoms.
I would say it mirrors closely to chickenpox. So you get a fever, malaise, muscle aches, swollen lymph nodes, flu-like symptoms first, and then the rash appears. So the rash will appear from the face on down. They're kind of pustular in nature, or boils filled with pus. And I have to say that from exposure, this is why it makes it tricky, right? From exposure, it can be up to 21 days
until you get symptoms.
Exactly.
Interesting. So, well, I'll get to vaccine in a minute, but why should people who are living with HIV pay sort of a little bit more attention to Mpox?
Yeah, it's not, so what hasn't been determined is just because you have HIV, are you at increased risk of getting Mpox? And the answer right now is no.
Okay.
But if you have HIV and your immune system is not strong, then you're putting yourself at higher risk. If you do have Mpox or get infected, then you're at risk of getting really sick and potentially ending up in the hospital, etc.
It just goes back to why we should be regularly getting tested for HIV if we're sexually active or using IV drugs and things like that, right? Know your status, know your health. So I was vaccinated in 2022. I think I got 2 shots in total. Do I need to go and get vaccinated again?
No. So I'm glad we brought this up. First, let's backtrack. How long do you expect to be sick if you are infected with Mpox? About 2 to 4 weeks. So think of chickenpox. When are you not infectious is once the blisters or the boils then scab over and the scabs get removed, and then you have new skin.
Yeah.
Right? That's when you stop being infectious. Right now, with the first wave that was hit back in 2022, a lot of individuals only got 1 dose. And it's recommended that you actually complete the 2 doses of the vaccine separated by at least 1 month so that you can actually get protected against both strains, clade 1 and clade 2.
So if I only got 1 shot back in 2022, do I basically have to start over?
No, you do not.
It's okay.
So you can just get the 2nd dose.
But if I only got 1 shot back in 2022, you're suggesting I should go and get the 2nd
Absolutely.
shot? Okay.
Yeah.
And that's pretty easy to get now too, right?
Yeah, but I would say you have time. I wouldn't just rush. I want to make this very clear.
Good.
Do not rush and just get this done, right? This is why we have social media, we have the news, trusted resources, right? And at that point, if you're seeing, okay, fine, there's cases that are coming into the United States, this is why the WHO puts out the alert so that we can be stocked as a nation with adequate number of vaccines.
Yeah, and it is a really straightforward vaccine too. I didn't seem to have any side effects, maybe a little skin irritation, that was it. So if I've had the vaccine, right, what's the efficacy of the vaccine? And let's say I somehow end up with Mpox. Is it going to be less severe, or what's?
Generally, if you're vaccinated, it is less severe. We're recommending, especially with this new strain that's coming about, to get vaccinated with the 2 doses. So it's only after you get the 2 doses that you're 85% it's 85% effective at prevention of Mpox.
And if I've had those 2 doses and I do end up with Mpox, is it going to be less severe because I've had the vaccine?
Yes.
So definitely go and get that vaccine if and when.
Yes. Again, if and when.
If and when. Okay, very good. Okay. Lastly, how can I best protect myself?
From Mpox? First of all, being aware of the risk, right? In areas that are higher at risk. 2 is just taking the necessary precautions. If you're at a party or a rave party, you might not necessarily want to be there if there is a spread of Mpox in that area. So remaining at a distance from people that potentially may have been exposed to. And if you suspect that you were exposed to somebody with Mpox, at least within the past 2 weeks, go and get yourself vaccinated as soon as possible. Go see a doctor. If you have any signs, symptoms, even if you think you may have been exposed, go and talk to your doc.
Is doxypep something I can use as a preventative measure? Forget about that in this case.
Not yet. Yeah.
Not yet.
No, I mean, it hasn't even been.
It brought up. There's me.
So
starting
doxypep is doxycycline, which is an antibiotic, right? Antibiotics do not kill viruses. Mpox is a virus in the orthopox family.
There it is. See, you break it down, you make it simple. Dr. Anu, thank you for your time.
Thank you for having me.
Good seeing you. That is going to do it. There's the update on the latest on Mpox. If you want more information, check out our website, pluslifemedia.com. And we are on all your favorite social platforms at Plus Life Media. Until next time, be nice to one another. Say hi to your mum if she's around. See ya.